Okay, I think we'll get started. It's 2 minutes past, and I'll hand over to Barry to kick us off.
Thank you, Una. Hello, champions. Happy New Year. Thank you for joining us again. I hope you found some time to spend time with your family over the holiday break, whether that be online or within your household. So I wish you the very best of years. I can see our obvious error already on the front of the slide that it says the 6th of January 2021. We'll update that for tonight. And also, champions, I would like to thank Una, who's actually on annual leave today, but put the slides together in response to the changes very quickly and is attending for us. So Una, thank you from me. Next slide, please, Una. Agenda for today, champions, it's the same agenda as always. I will go over some key messages related to COVID-19 within Merton and London. We will have some welcoming introductions. We will then go into our Champions Corner, so an opportunity for you to ask questions, make statements, opportunities, or just give us an update on how you're feeling. And then we'll go into today's theme, which will be about the national lockdown. And then there'll be another opportunity for us to answer any questions or have a discussion on any of the themes that Una presents to us. And then we will finish by 1 o'clock today. So Una, next slide, please. So welcome to any of our new champions today. If you would just take a moment just to introduce yourself in the chat box. I can see that Aziz has got there already, so thank you for doing that. That's fantastic. And as usual, use that chat box throughout the session to ask us any questions. We will do our best to answer any questions you might have during the session, but if not, we'll answer them later on this week. Again, it's up to you if you choose to have your camera on or off. It's absolutely your call, but please have your microphone off when you're not speaking, just because it reduces that feedback. So, next slide, please, Una. A tough few weeks, champions. You will all know that England is now in another third national lockdown. The key message there is that you must stay at home. The data that we have, which are presented there, is from just slightly before Christmas. So the data goes up to the 30th of December, so there's a slight lag in that data. What I can tell you is Merton's 7-day rate had increased from 593 to 860 in a week. That is substantial increases in the 7-day test rates within the borough. And that also overlaps to the over 60s 7-day rate. If you remember, over 60s are more vulnerable to severe COVID. And so that over 60s 7-day rate had increased from just under 400 to 483. We're expecting more data to be released in the next few days so that we can get an accurate picture of the position over the Christmas and New Year period. But what I can say to you is that we have seen increases in all areas of the borough. It's across the east of the borough, it's across the west of the borough, and it is affecting all age groups across the borough. Again, much in the press, but what we've seen is that new variant is far more transmissible than the previous version. And that new variant is driving those increases. You heard me say just before Christmas, I think it was the 23rd of December, there are still no signals that the new variant is producing more serious disease. And our assumption at the moment is that vaccination still remains effective. But as I say, transmission is far higher with this new variant, so we need to be incredibly careful about our interactions and follow the guidance and the rules. And again, the NHS across southwest London and London is facing severe pressure across the city. And the single most important action that we can take is to stay at home to protect the NHS. Some good news over the period, Christmas period, the holiday period, was that the Oxford vaccine has now been approved. As you will all know, this is easily stored and transported, so it eases some of those operational issues, because if you remember, some of the vaccines had to be stored at very cold temperatures. That's been piloted in hospital sites over the last day or so, and it's going to be rolled out very shortly by the NHS on that unprecedented scale. Again, the key message around vaccination is that wait till you're invited. So our colleagues in the NHS, your GPs, will be making telephone calls, email, text messages, working with the many volunteers. Some of them are probably on this call, so that we can get people invited and get them vaccinated at the appropriate time. You've heard me talk about the asymptomatic testing program for perhaps a few weeks now, but we have now launched. So we now have a program of fast LFT testing in the borough. So there are two routes for the asymptomatic testing. The first one for Merton residents is via the community testing site, which is at Morden Assembly Halls. And then key workers, voluntary and community sector staff and volunteers and carers are able to access an LTF, so a fast asymptomatic test from community pharmacies across the borough. So we have got 6 pharmacies launched yesterday, 2 more joining today, 2 more joining tomorrow. So we're slowly building up the capacity of that particular service. The link is there for you to be able to access a test. Like I say, we have just launched the program. We're scaling up slowly, but I'm really pleased to be able to tell you that that program is in place. And a reminder that asymptomatic testing, the LFT, is for asymptomatic testing only. If you have symptoms, even mild ones, you should self-isolate immediately and seek a test at nhs.uk coronavirus or call 119. Please do not attend asymptomatic testing sites if you have symptoms. In other places across the country and across London, we have seen positivity rates of 7, 8, 9% at those asymptomatic testing sites. That's probably indicating that people are using them with symptoms. That is not appropriate, it's not suitable, and we would discourage anyone from doing so. So I've covered a lot there, champions. Again, feel free to come up with any questions or make any comments in Champions Corner. Put the questions in the chat box, and I'll hand over to Una to deliver the rest of the.
I'm going to quickly go through the COVID-19 community champions, who they are and what they do. But first, just for any champions that have joined us since 12 o'clock, Happy New Year to everyone, and I hope you all had a nice break over Christmas. So the champions, who is a COVID-19 community champion? Anyone who lives or works in Merton and wants to help stop the spread of COVID-19 by sharing clear and consistent messages from the NHS and public health can be a COVID-19 community champion. I had a look this morning and we have 128 champions, which is fantastic. So again, thank you all for helping spread the word about the network. We've got a great range of champions. We've got residents, councillors, service providers, officers from the council and the CCG, VCS reps and clinicians. So it's really great to see our champions numbers getting bigger and those messages being spread wider. So thank you, everyone. The role of the champions. So the role is a 3-step approach. The first step is to receive key messages. So on a Wednesday via our drop-in sessions, on a Friday via our weekly email, and also through the WhatsApp group. The second step is to spread the word. So to share these key messages, resources, and discussions from our workshop themes with your communities and networks. And the third step is to feed back to us what's working well, what isn't, and what are the issues in your communities. And also to ask us questions. And that fits nicely into what the COVID champions do not do. So champions are not public health specialists or COVID-19 experts. And if you're asked a question and you're unsure of the answer, or you don't know, you can always ask us. You can use the email addresses on the screen here. You all have my email address by now. So you can email us whenever. You can ask us questions during the Champions Corner section in the drop-in sessions, and also in the WhatsApp group as well. And we'll do our best to get back to you as quickly as possible. So we're at Champions Corner, and for any new champions, this is an opportunity for you to ask any questions to raise any issues or key points or comments or suggestions about the network itself. So does anyone want to get us started? Has anyone any questions or things that they'd like to comment on? I'll just have a look at the chat box. Logie, you would like a list of the pharmacies that do testing.
So on that one, Una, I can take that. Logie, when you go onto the portal to book a site, it will show you the sites that have available slots. So that's the preferred route, because if I give you a list of the 10 or so pharmacies, when you go to book, the one of them might not be on that list. That's because all the slots have been booked. So the best thing to do would be to go onto the portal, and it will show you the available slots for key workers, volunteers, and carers within the borough. That would be the best route. But I'm really hopeful that we get almost all of the 40 community pharmacies delivering the program across the borough.
Barry, just can I ask a quick question? Yeah.
Of course.
On the 29th of December, I asked for a test kit, and they said they asked me all the question and told me that go see a GP, and I phoned my GP on 30th, and I ended up in hospital, and they found everything negative. So yesterday morning I rang them for test kit. They said no, nothing wrong. It's too late now. You've got to go see a GP again. So what's your answer with that?
Okay, so let's take that one outside, Logie, because I think it's a specific example. But the question is, who did you speak to request is it a PCR test that you wanted? Because that should have gone via the national portal.
119.
Yeah, 119 should have been able to offer you a test, because there's no everyone that requests a test should be able to access a test with symptoms. So let's talk about that outside, and we'll smooth that out for you, Logie. But I'm sorry to hear about that.
Thank you.
Thank you.
Thank you, Logie and Barry. Una, you had your hand up.
Thank you. Yes, just quickly. I'm Berger at local church, and I've just come off a meeting there, and we're proposing to bring back our services. And I was just asked or put on the spot about the Merton rate. I actually thought it was 930 per 100, and that's what 930 per 100k was a figure that I'd seen. And even that I thought wasn't up to date. I just wondered if I could have access to what the current figures are for Merton. I may be from another source, like Birch being a council, but I just wondered if we had up-to-date figures as of sort of yesterday or...
Yeah, so the figures that I've given you there are in the published SITREP report, which is a confidential document. But again, Una, I'm happy to have a conversation with you, because as a health and wellbeing board member, about the most recent data, clearly.
That'd be very kind. Perhaps we could do that afterwards.
Sorry, I was on mute. Thank you, Una. Marcella, I see your hand is up as well. You're on mute, Marcella.
Yeah, it's with regards to the rapid testing. Is it also possible for carers and key workers who don't live in the borough to be tested? Or do you have to prove, because there are other, there are, for example, key workers who work in Merton but they don't live in Merton, or carers who don't live in the borough.
Yeah, really good question, Marcella. What we will do, there is a national portal that's been developed so that you'll be able to see where the asymptomatic testing sites are across London and England. We will add that, or the information from that, onto our website so that people that live in other boroughs will be able to see where their local sites are. For example, I live in Greenwich Borough. I'm not going to travel to Merton to go to an asymptomatic testing site, but I know that Greenwich Council have one around the corner from my house. So we'll make sure that we make that information available as well. Okay. That's a really good idea. Thank you.
Thanks, Marcella. Has anyone else any questions or comments, or how do you feel now that we're in a national lockdown? Sarah.
Hiya, hi. I just wanted to say actually it feels a lot more secure, knowing that everyone's in the same kind of restrictions. I think it's, although it's awful, I think it's actually made it a lot more clear for people to follow, definitely follow the rules, because actually there's not many rules. You know, it's just one main rule. So I think given, you know, the extent of it all, I do actually feel a bit better about it all. So.
Thanks, Sarah. Yeah, I think having a lockdown or restrictions across England makes it a little less confusing when it comes to tiers and people living on borders with different tiers. So I can see where you're coming from there. Who else has their hand up? Maria, you had your hand up.
Hello everyone, Happy New Year. Just saying from a sort of an RSP perspective, obviously we've got COVID marshals out and about now and they're out every day. So if people have got any concerns when they're out and about, particularly in relation to supermarkets or anything, let me know and I can direct them into the right area. In terms of enforcement, having the tighter restrictions now is going to make things a lot easier for things like alcohol sales that have now been stopped for click and collect and all. So it should be a lot more easier for us to enforce. But just to say we are here and if anyone's got any concerns, do let us know.
Thanks, Maria. Emma, you also had your hand up.
Hello there. Some comments and then a question. Probably Maria might be able to help with my question following what you just said actually, Maria. But yesterday I went to just Mitcham, where the big Morrison supermarket is, in the middle of the day, and I was quite surprised to see so many food places still open for pickup. I guess people can still go in and socially distance and sort of wait outside and take it home. But I think what worries me is now that the schools are closed, parents are still allowing children sort of under 16, I'm talking about, to still sort of congregate in town centres. Lots of them haven't got masks on because they probably feel they don't need to, and still go into these food places and sort of go stay around in groups outside. I feel like in the first lockdown everything was closed, but now it's just closed to sit in. So it's not really a full lockdown in Mitcham at the moment.
I take on board what you're saying. Obviously, food premises can still operate as a takeaway service, but they are encouraged to try where they can to pass outside. A lot of them are doing tables at the front, but sometimes that's not possible for payment, etc. But what I will do is I will pass on your concerns to the COVID marshals, because just their presence with the High Vis Fest will make a difference. And obviously, if there's an ongoing problem, then we can get the police links involved as well, to disperse groups, because they certainly shouldn't be hanging around now it's lockdown. But thanks for bringing that to our attention. I will forward that on.
That's brilliant. Thank you.
Thanks, Emma. Robbie, I see you had a question. Would you mind asking it to on the call, asking it in verbally?
Yeah, that's fine. Can you hear me?
Yeah, perfectly.
The first question was about whether unpaid carers, for example, those who are available to provide respite, for example, for people affected by dementia or any other long-term health condition, whether they are prioritised in the vaccine rollout. And the second question was related to that, and was related to what Barry just answered from Logie, which was Marcella, sorry, which is about whether an unpaid carer is eligible to get the vaccine in Merton if they live outside the borough, or do they have to contact their GP and get the prioritised vaccine in Croydon where they live? Thank you.
Thanks, Robbie. Should I take that one, Una? I guess the first part of that about unpaid carers and the prioritisation list, I will have to refresh because the JCVI have obviously up to the Joint Centre for Vaccination has changed how the vaccination's been delivered within like with the new Oxford vaccine, but also you will have seen in the press about the scientific debate on whether one dose is better than two and the pausing and the delaying. Let me double check whether there's been any changes of that, Robbie, on the effect of whether carers have been moved up or down the list, but let me get back to you on that. The second one, again, I might need to get back to you, but my current understanding is that you are invited by your GP. So if your GP is in Croydon, then you'll be invited to attend a vaccination site within Croydon Borough, even if you volunteer in other places. But let me double check that and I'll get back to you on that one as well, Robbie. I want to make sure I give you the right information.
Thank you, Robbie and Barry. Anyone have any other questions? I'm just going to look through the chat box.
There's the same questions from Sue and Emma relating to takeaways versus deliveries. Maria, is there anything else to kind of add to those comments there? So I thought food outlets were not supposed to continue takeaways, that it was supposed to be deliveries only. And then from Emma, every single food place was open in Mitcham, KFC, cafes, Greggs. I also thought they should be closed, but apparently they're offering takeaways. It's worrying it's not a full lockdown. And again, I'll let Maria come in just in a second, but I guess it's finding that right balance, because these are businesses and many of them are local businesses that we want to make sure that they can maintain their business going through this difficult period. So there's a difficult balance. But Maria, do you want to just clarify what the guidance and the law says?
Yeah, certainly. So food premises are allowed to operate as a takeaway service. There is a change this time round with alcohol, so you can't purchase alcohol for takeaway. Obviously, you can get that from an off-licence or a supermarket, but not click and collect or anything like that for alcohol. That's the change. But food businesses can. So, for example, a restaurant can change its remit into a takeaway rather than just be a sit down, and they are allowed to do that in law. So you will find a lot of premises still opening. Obviously, if you've got any concerns about a particular premises not being COVID secure, they still need to be following the rules, then we will follow it up.
Thanks, Maria. And again, I can see that Emma, Boris announced that they should be closed. So the law came into law. Is that the right phrase? Today. So what we can do, we can check those regulations, and we will be able to send the link to you. But yeah, I know that Maria is very, very up to date on what the law is actually going to say on this. Thank you.
Thank you. Sarah, you have your hand up. Was that a legacy hand?
Hi, just one quick thing. I'm wondering how the communication between 111 and local healthcare, particularly emergent local healthcare. My husband recently had a recurring eye issue, very important eye issue, and he was sent to hospital 3 times in the last 2 days with the clinician who passed on to contacting the particular service he was wanting to access about what they should do for him, and he ended up not getting treated 3 times because there wasn't the equipment to deal with it, and 111 and the service were not communicating properly, and so he was sent 3 times into a risky environment. Given that we're shielding, we've been trying to be really careful about that. We haven't been out for months. I'm just wondering how much to expect from someone regarding that, who actually being in a crisis and not sure what to do. It was very stressful for all of us, for the 2 of us. I'm wondering whether that can be improved, the communication between the emergency connection there, because actually that is not, especially now, that is not ideal, and it's very anxiety provoking, considering our high risk and we are children. I'm wondering if you can chat with them very perhaps about making sure communications are better there.
Thank you, Sarah, for sharing that. I'm sorry to hear about that challenging time and the experience that you had. 111 do amazing things, but by the sounds of it, it didn't quite happen as it was supposed to happen. I know that we've got some of our NHS colleagues. So Sarah, what are things really important in those services? And the quality assurance and those lessons learned is really important for them and us. What I'd suggest is if we connect you with Aman, perhaps, or Ben in the NHS team after the meeting, to make sure that your feedback gets through to the right place, because that's how we learn from these experiences. But Sarah, I hope that's okay. But thank you for sharing that challenge.
Of course, thank you. Cheers.
Thank you.
Thanks, everyone. If there's no more questions, I'll move on to our workshop theme this week, just because of time. Anyone? Okay. So our workshop theme this week is on the national lockdown, stay at home. So on Monday morning, the Prime Minister announced that there will be a national lockdown and has instructed people to stay at home to control the virus and protect the NHS and save lives. Over the next few slides, I will go through what this national lockdown looks like, what's changed, and we'll go through some FAQs as well. So the infographic of the lockdown is similar to what you've seen before for the tiers. It's a good resource that outlines the national lockdown restrictions, and it covers key aspects such as leaving home, meeting others, exercise, leisure and sporting facilities, travel, and much more. And I've uploaded this onto the Champions webpage as well for info if anyone would like to go and download it after the meeting. It's available, and we'll share with you as well in our weekly email. So what's changed? As we all know, England has been placed in a national lockdown, and this is due to a rapid rise in infections, hospital admissions, and case rates, and with hospitals being more under pressure than any other point during this pandemic. So it's really important that we do stay home. The national lockdown applies to all areas across England and replaces the tiered system that we previously had. So what's changed? Well, schools are closed other than for vulnerable children and children of key workers or critical workers. We must not leave our houses unless we have a reasonable excuse, and this includes for work and volunteering. We can leave for work purposes where it's unreasonable to do your job from home, and you can also leave your home to provide voluntary or charitable services. We can leave for essential activities, to buy things at shops such as food and medicine or obtain services. For education and childcare, you can only leave home for education, registered childcare and supervised activities for children where they are eligible to attend. Access to education and children's services for school-aged pupils is restricted, but people can continue existing arrangements for contact between parents and children that live apart, and this includes childcare bubbles. Meeting others and care, you can leave home to visit people in your support bubble, if you're permitted to form one, to provide informal childcare for children aged under 14 as part of a childcare bubble, to provide care for disabled or vulnerable people, to provide emergency assistance, or to attend a support group with up to 15 people, or for respite care. We can also leave home for exercise, either alone with our household or support bubble or childcare bubble, or with one other person. And we should limit this to once a day and not travel outside of our area, our local area, if possible. And if exercising with one other person who's not in our household support bubble or childcare bubble, we must maintain social distancing. We can leave for medical reasons, so that includes to get a COVID-19 test if you've symptoms, or an asymptomatic test, or for medical appointments and emergencies. We can leave for harm and compassionate visits, so you can leave home to be with someone who is giving birth, to avoid injury or illness, to escape risk of harm. You can also leave home to visit someone who's dying, or to accompany someone to a medical appointment. And we can leave home to attend a place of worship. So we can also attend a funeral or a wedding ceremony. And I'll go through the numbers of those in a little bit more detail in the next few slides. But we should maintain social distancing from anyone that we don't live with, again, who's not in our support bubble or our childcare bubble. Hands, face and space. So you've heard me speak about the importance of this for the past few months, and it's still a key component in reducing the transmission of the virus. So washing your hands regularly with soap and water throughout the day will reduce the risk of catching and passing the virus on. COVID-19 can be found in tiny droplets coming out of our nose and mouth. So wearing a face covering over your nose and mouth reduces the risk of spreading the droplets that carry the virus, and this means you're less likely to pass it on. And larger droplets can land on other people, so spreading the virus through droplets is most likely when you are less than 2 meters apart, and when you are with people who are not in your household or support bubble or childcare bubble, it's really important to keep 2 meters apart. And what's not mentioned here is ventilation and the importance of keeping indoors areas ventilated by opening windows or window and a door, particularly when you're with people that you do not live with, or in your childcare bubble or your support bubble. And I've pulled together some frequently asked questions as well that will go through the nuances of the restrictions in lockdown. So how long will we be in a national lockdown? As it stands, we expect to be in a national lockdown until the middle of February. If the pressure on hospitals eases. However, this will be reviewed on an ongoing basis. Can I meet my friends or family in a private garden? No, you can't meet with anyone that you do not live with who is not in your support bubble or childcare bubble in a private garden. As I mentioned earlier, you can leave home to exercise, but not for the purpose of meeting people socially. You should only leave home for exercise once a day. You can exercise by yourself with the people that you live with, those in your support bubble or childcare bubble, or if you're by yourself with up to one other person. And you should not travel outside of your local area either for the purposes of exercise. And some public outdoor spaces I've included on the slide are parks, beaches, countryside, forests, public gardens, heritage sites and playgrounds that we can still continue to visit. Are there restrictions on weddings, civil partnerships and funerals? So yes, there are. There's funerals can have a maximum of 30 people attend. Weddings and civil partnerships should not take place unless in exceptional circumstances where one person is seriously ill and is not expected to recover. And in this case, it's a maximum of 6 people who can attend. Can parents and guardians continue to access childcare? So yes, there's several ways people can continue to access childcare, and this includes in early years settings. These remain open. Vulnerable children and children of critical workers can continue to use registered childcare, childminders. Parents will be able to continue to form a childcare bubble for the purposes of informal childcare for children aged under 14. And if you are in a support bubble, you can also use your support bubble for the purpose of informal childcare as well. And any nannies or au pairs can continue to work inside the home, providing childcare as well. So can I travel within the UK and outside the UK? You must have a legally permitted reason to travel within the UK or internationally. And these reasons include for work, where you cannot work from home, for education and for caring responsibilities, to attend a medical appointment, for buying goods such as food or medicine, for outdoor exercise, or to attend a veterinary clinic. Can I go to the gym or my exercise class? So indoor gyms and sports facilities will be closed. Outdoor sports courts, gyms, golf courses, swimming pools, etc., riding arenas will also close. And organised outdoor sport is for disabled people will be allowed to continue. But for exercise purposes, we can exercise outside with up to one other person or our household support bubble or childcare bubble. So will the shops be open? Non-essential retail must close. Retail venues can continue to operate click and collect, both for food and goods. And essential retail will remain open. So this is food shops, supermarkets, pharmacies, and garden centres and suppliers of building products. But any non-essential services such as clothes shops, they will close. Can tradespeople do work inside my home? So as before, tradespeople can still enter your home to carry out work as long as they follow the national guidance on how to work safely. Are places of worship still open? Yes, places of worship are still open. However, as before, we are asked not to mingle with anyone who we don't live with, who's not in our support bubble or childcare bubble, to maintain social distancing. And there will be a limit on the number of people that can attend as well to make it a COVID secure premises. How do I know if I have coronavirus symptoms? So the symptoms are, as I'm sure you're all aware by now, a new continuous cough, a high temperature, a loss of or a change in your normal sense of taste or smell. And if you have any of those symptoms, it's really important to get a test. You can book a test by calling 119 or by using the link on screen here, nhs.uk/coronavirus. We have 2 testing sites in Merton, in Elm Nursery Car Park and Merton College. And this is for people who are symptomatic. So as Barry mentioned earlier, the asymptomatic testing will be carried out in a different test site. I've included this slide, or if anyone attended the last drop-in session before Christmas, it was just some resources, it was just some services that are available for residents in Merton who perhaps need some help and support. And I thought it would be particularly useful as well with the lockdown, that a lot of people will potentially be struggling. So there's Merton Uplift if for anyone who's experiencing difficulties related to stress or anxiety, depression. The Community Response Hub is really good service that's available for people who need support. And they do offer telephone befriending, but a lot more as well. And there's several helplines here as well, such as the Samaritans, Cruise Care, and for young Londoners, Young Minds, Childline, etc. So we'll share this again with you on Friday But if you know of anyone who might need any extra support, please do let them know and point them in the direction of any of these services. Does anyone have any questions? I've seen someone has put a comment in. Could it be a separate slide for others to pass on? Yeah, we can do that. I can make that slide a PDF that you'll be able to easily share, and I'll share that with you all. I'll put it up on the Champions webpage as well. Thank you, Aziza. Bo, you had a question. Do you mind asking it to the group?
No, it's not really a question as opposed to an observation. It's just you've mentioned the 2 places where testing are taking place. Lots of people won't know where those sites are. So if any publicity could include the address and postcode, it will help people navigate and locate those sites.
And Bo, again on that one, similar to the asymptomatic testing one, when you go onto the portal, it will show you the nearby sites to your postcode, and so clearly you can get you can get a PCR test from any of the PCR testing sites across the country, effectively. So that's why there isn't any public literature saying we have 2 within the borough and these are where they are, because they're not open for walk-ins at the moment. When you go to the website, put your postcode in and it will show you the local sites that are nearby.
Great, thank you.
Aziza, your hand is up.
Oh, sorry, I'm not contradicting Barry, but I just received through the letterbox from Councillor Mark Allison, giving the address of the Merton community testing site. So they've given the address at Morden Assembly Halls. Is that confusing?
We're trying to make it so it isn't confusing. Again, there are 2 sides to testing. We're going to get better at it. So the letter's accurate. They are the postcodes. That is the correct testing sites. The Morden Assembly Halls is the asymptomatic testing site.
Yes.
So that's the regular or the one-off testing sites. PCR, if you have symptoms, you go to the national portal. Both of those testing, you go to the portal, book your test, and then it will show you the available slots nearby. So yes, you're absolutely right, Aziza. But always go to the portal. It will show you the available slots to go to.
Thanks.
Thanks, Aziza. Syrian, I see your hand is up.
Yes, yes, I am. I would like to know regarding, we have arranged a training, RSPH training, well before Christmas. And this has been training for a long time. And this is at one of private hospital in Merton. The total group that will be less than 10. And we have followed the restriction of hand, face, and space. I would like to know if that would be allowed within the new restriction.
You can meet with others for the purposes of work or training, but if possible, it would be better to move it remotely.
Unfortunately, they wouldn't accept remote. This has been on offer since the start of the lockdown. And once that eases, they were happy to have it in a conference room in the hospital. And I went there and checked everything, and we're following all hand, space, and face. But I want to know exactly if it will be okay or not, please.
Serene, so what I would ask you to do as one of our commission services, if you have a conversation with Una outside the meeting with a copy of your risk assessment, we can work that through, then we can compare that with the rules and the guidance. The guidance is really clear. We must be staying at home as much as possible apart from essential reasons. If that is not an essential training program, my view at this stage is that it shouldn't take place. But let's have a conversation outside to make sure that we're able to provide the right support and advice.
Thank you, Barry. Thanks.
Thanks, Syrian. Emma, your hand is up.
Hi, it's a question about the vaccines, if that's okay. So I've got quite a lot of clients asking me now, a little bit worried that they haven't had their call from the GP or anything. Is there anyone here that can sort of advise something I can say about peace of mind, or a sort of process in how it would happen? And, you know, because I've got a lot of vulnerable clients. Most of my clients are over the age of sort of 70 plus in the borough, and quite a lot are saying that they haven't been notified yet.
Thank you, Emma. Really good question. I think we are going to focus next week's session on vaccination, because I think there's many questions there. But I'm looking on the call. I know that Aman is on the call and Ben, but clearly vaccination is led by the NHS. So Ben or Aman, is there anything that you can say at this stage to respond to Emma's concerns, or question rather, or should we follow up after the meeting?
Hi Barry, sorry, it cut out for me again. Could you just could you just repeat the question for me?
Yeah, sorry. So Emma's question was that she works with some vulnerable residents who have a number of questions about vaccination and when they're going to get the call from the GP. So as the NHS is leading on the vaccination programme, could you give us an update on what you know so far, bearing in mind we're going to focus next week's session purely on vaccination?
Okay, Emma, I'll be happy to follow up with you after. I don't have much more information on that apart from patients are being contacted when in a priority order. So if they are vulnerable patients, I can anticipate they'll be contacted soon, but I can't give you any specific information on that. I'll be happy to take any questions that they might have and try and get answers to them. And we are hoping to do outreach with a lot of the community groups, taking clinicians out with us and pharmacists to answer any of these questions that the public do have on vaccines. So hopefully we can build confidence that way, but I can take that offline for you, Emma, and find out specifically.
Thank you so much. Yeah, and I mean, there was a lady who's she's got dementia, and she was really worried about not managing to get to the clinic herself. So that was another question that's going to come up quite a lot. How, you know, is there anyone that can accompany people if there's no family members?
Absolutely, and that is a question we were asked at the last session we ran as well, specifically about transport, elderly individuals, how they're meant to be travelling on public transport and whether they can get additional support there. So it is a question that we've taken back as well, and I can find out and get back to you.
Thank you so much.
That's all right.
Thanks, Aman. Una, Councillor Una has a question for you. Can Una's son play tennis with someone in the same household in a park?
So outdoor facilities, sports facilities are closed. But Maria, I'm going to ask you if that includes, I would assume that includes tennis courts. Maria, do you know if that's correct?
It does include tennis courts, I'm afraid. I'm guessing unless there's a disability there. Obviously, there's an exemption there for disabled sport, but no, they can't. They can obviously take it and support themselves with the rackets, but not a tennis court because it'd be closed.
Thanks, Maria. So I see you have a question. Do you want to ask it in the group?
Sorry, I was busy typing again. We had a mental health forum yesterday afternoon, and one of the issues that was raised as a concern was the number of vaccination appointments that are being missed, and those vaccinations then become unusable or thrown away. Whilst there's lots of people who haven't been called and won't be called in the immediate future for vaccinations who are eager to get vaccinated, and whether or not there could be some sort of reserve list, or how public health and the local health authorities could look around being more creative at not wasting vaccinations that are, you know, it's a scarce resource, so not wasting our local vaccination.
Thank you, Bo. Yeah, really good point. Nobody wants to see any appointment slots not being used. I think it's really important that we make the most of those slots that are available, particularly as we know they are for the most vulnerable people at the moment. I'm sure that that is something that NHS colleagues have been working through about how to make the most of a kind of a plan B approach. Let's pick that up. If Aman, you'd be able to pick that up for us, but I'm sure we could ask that question next week as well on that vaccination specific session.
Absolutely. Thanks, Barry.
Thanks, everyone. Logie, I see your hand is up.
Yeah, Barry, Una, I understand from yesterday's mental health forum that somebody said the Mitcham Library got the testing site. Is it true?
Sorry, Logie, say that again. My line went.
Mitcham Library car park is a testing site.
There's an elm nursery which is nearby, yes.
Okay, thank you.
Thanks, Logie. Emma, your hand's up. Is that a legacy hand? Kemi, I see your hand is up. Have you a question or a comment?
Yes, the question really, it's about people who run businesses one-to-one, so providing things like Pilates or therapy, whether they can still open those businesses or, you know, whether people can still receive that one-to-one therapy in their homes.
Indoor sports is closed. As for therapy, I'm going to ask Maria.
I'll have to get back to you on that one because I'm just checking if there's an exemption for medical reasons. There may well be. So can I get back to you on that one? I'll check the guidance because the law only came out yesterday evening, so I haven't had a chance to read it all yet. But I will get back to you.
All right, that would be, yeah. And it's for people who run such businesses as well, whether they can still keep them open.
We'll need to look at the difference there between a medical appointment and something like a personal trainer, because clearly there are two different things there. So we'll need to check both of those sides for us, please.
Thanks, Kemi and Maria. Just looking. Do we have any more questions? Pam, your hand is up. You're on mute, Pam.
Okay.
Yeah, we can hear you now.
Sorry, there's a lot of driving schools around, people in cars learning how to drive. You know, I mean, should they still be operating? There seems to be quite a few around this way.
I'm actually going to refer back to Maria again. Apologies, Maria. I don't know the answer to that one.
Actually, it's not one I've come across, but I imagine they probably could operate a business. They will be operating in a COVID secure way in terms of wearing masks and having ventilation and the cleaning regime. So I suspect they probably can continue, but I will check. Unless it's deemed one of the businesses that need to close, then they can operate. I will double check though for sure.
Thank you.
We'll get back to you on that one. Thanks, Pam. And thank you, Maria. Do we have any more questions? If not, I will go on to next steps. So we'll continue to answer your questions. We've had quite a few today. So as usual, any that we weren't able to answer, we will pull them together and our responses and share them with you on Friday. Our next session will be next Wednesday as usual, the 13th of January, and our workshop theme will be on the vaccination. We ask that you share the key messages with your networks and your communities. If you know of anyone who you think might be interested in joining the network, please do send them our way. If you haven't already, we just ask that you register using the link on the screen here to make sure that you get your weekly email and the links to the drop-in sessions. If as always, feedback to us what's working well and what isn't. And the email addresses are on the screen there. And of course, ask us any questions. Bo, I see you have your hand up.
Yes, sorry, Una, just a rather crude plug about the Young Community Champions group that are meeting tonight, and I would encourage any of us mature community champions to encourage any young people within their households or networks to join that young persons community champions group that's meeting tonight. And I'm just trying to put the link in the chat.
Thank you for the reminder, Bo. Yes, if you do know of any younger people who would also like to be in a network of community champions, there's the Younger People Champions that Bo's just mentioned. And thank you for sharing that link as well. That's really helpful, Bo. And also, if you would like a Champions badge or a Wimbledon tennis towel, please do email us with your postal address and we'll get those sent out to you. Early next week we'll get those sent out. So thanks everyone, and we'll see you next Wednesday.
Thanks everybody.
Thank you.